Good evening. Welcome to another episode of Aging with Attitude. My name is Phil Koch. I'll be your host this evening. And tonight we have a guest, a friend of mine that's been in the Charlotte area quite a while, Jennifer Szakaly with Caregiving Corner. Jennifer, welcome to the show.
Thank you for having me.
Yeah, it's great to have you. Jennifer owns a company called Caregiving Corner, which is geriatric care management with 2 offices in the region. Is that right?
Yes.
Yeah.
Mm-hmm.
Well, let's start with telling us more about what a care manager is and what you do as a care manager.
Okay. A care manager is someone who is an expert in the field of aging. They act as a professional advisor to families who are caring for an aging loved one. So that's usually a parent. Sometimes it could be an aging spouse.
Yeah.
And we advise them on all different parts of the long-term care system. So people sometimes contact us with questions about benefits, about choosing service providers, how to keep a loved one at home, navigating the long-term care system. All of those are kind of parts of what a care manager looks at. Generally, a care manager is tasked with the goal of keeping someone as independent for as long as possible. That's what we'd like to do for our clients. But we have to look at all aspects of that person's life in order to do that. So we're looking at their family support, we're looking at their budget, we're looking to make sure that their legal documents are in place. We're checking to see what medical conditions they have, what medications they're on. So it's a very holistic approach to planning for someone who has an aging family member.
Right. And it's not just the person, the client could be a daughter or a son, or it could be the people that eventually might need various services as well, right?
Right. We're contacted sometimes by the client themselves, the older adult, sometimes by that person's spouse or a family member, sometimes even a neighbor or a service provider who's identified that this person is possibly at risk for either going into an assisted living community prematurely, or maybe they're at risk for malnutrition, being at home. The person who knows this individual knows that they're not eating what they should be, or maybe not taking their medication. So any number of different people can contact us initially, to kind of get that process started. But very often it is a family member, and as we're seeing the population age, baby boomers largely make up the folks who are calling into us, the adult son or daughter, and they've got a lot on their plate. They're juggling their own careers. They've got kids at home most of the time. They've got marriages. They've got a lot going on, and so when this caregiving starts to creep up and really is something that's time consuming in their life, it's something that kind of catches them off guard in some cases, and so they know that they need some help.
So it's almost as if you're if I'm not putting words in your mouth, a consultant
Mm-hmm.
really for the family to navigate through the senior industry in our region.
Right, absolutely. Yeah, even though the older adult is our client, you can't do something for or with the older adult without impacting the rest of the family unit. So it very much is a family approach, and we approach it that way. You've got to get all the family members on board. You've got to get everyone headed in the same direction for this to work. If we're going to put a plan in place and there's someone who's working against the plan, then it's got problems from the very beginning. So we want to get everyone on the same page, help them understand what we've seen objectively about that person's needs versus what the family might be seeing through the lens of having an emotional attachment with that person.
Right.
And then we're going to help get them on track with whatever the plan for that person needs to be.
And that plan could be all-inclusive. It could be helping with getting documents together, or pointing them to the place of getting documents together for like advanced directives.
Absolutely.
To helping to select a retirement center, or to bring it in home care or health care, or DME equipment, it's all of the above.
Right, and for some clients it ends up being a lot of that. When we start working with someone, very often they're in a home setting, and so we're helping them be independent, but then we're able to identify when it is more appropriate for them to be transitioned into a care facility of some sort. But sometimes that person has a visit to the hospital, and sometimes that can trigger different needs as they're coming out of the hospital. So it's as much as we try to plan, we can't obviously anticipate everything that's going to happen. So there's some cases where it looks like we might get involved and do only certain things, and then as it turns out, we end up doing a good bit more for that person.
Right. So give me an example, without naming names obviously, of a normal type of client that might call. Obviously it's just an example of Jane Smith that called your company that needed help, and what you did for them.
Okay. Yeah, a very typical call for us is someone who has just gotten a diagnosis of usually Alzheimer's. That's a very common diagnosis.
Yeah.
So we'll get a call from a family member. And in one example that I can think of, the son contacted us. He's out of state. He really wants to do something to help. He has a sister locally. His parents live together, but one of his parents has been diagnosed with Alzheimer's.
Right.
And so he recognizes that they need to have a plan, because operating without a plan, it's pretty precarious. And kicking the can down the road is what we would call that. It's just you end up putting kind of Band-Aids on the problem and not really addressing some things that could be looked at from the very beginning. So when we get involved, that initial contact was us sitting down with the older gentleman and his wife, the daughter and the son-in-law, who were local and able to provide some support. And then of course the son, he actually Skyped in and wanted to participate in the call and be a part of that process as well. And so we begin with a very frank conversation. We're listening to the older adults to hear what their desires are. So they'll say things like, I want to be at home, I want to keep driving, I want to be able to do this by myself, I want. You hear those statements.
Right.
From the family, you hear, I need to know mom is taking her medications, I need to know dad is safe, I need to know this is going to go okay. So we're trying to kind of look at those and marry the needs and the wants of the family to come up with some universal goals that they can get behind. And then we're putting a plan, how do we get from where we are today to where we're going to be. So for this particular couple, the older gentleman was still working and needed to know that his wife was going to be okay at home during the day while he was working. And so within their budget and their long-term care insurance policy that they had, we identified some different services and some technology that they could put into place so that she could be at home safely with minimal supervision and interference so that she could continue to feel independent. But we had some concerns, about her safety that obviously needed to be addressed.
Right.
And so when putting that plan in place, getting that first leg started, what we also did was let the family know if these things start to happen and we identified some key indicators, that's a good time to call us back because that means we're going to need to tweak the plan.
Right.
And so we put some kind of classic warning signs for them to kind of watch out for. But the plan got them started, but then we also kind of extrapolated it out to 6 months, 12 months, down the road. These are some of the decisions that you'll have to make. These are some of the things you'll want to go ahead and start talking about. And the key to doing that up front is that obviously, particularly when you're dealing with a dementia diagnosis, if you're having that conversation with the person with dementia, which I encourage people to do, you've got to do that sooner rather than later. And so waiting to have those family conversations when mom is already in the moderate stages, she's not going to be able to participate and understand the conversation any longer. So, so we were in this situation able to work with the mom to really kind of understand what her concerns were. And those were, of course, the primary driver behind how we shaped the plan. But we put together a plan for them and then remained involved on an ongoing basis because we want to check on the client and also the family. We want to make sure that what we proposed was actually enough support to take something off of that daughter's plate so that she felt like she was getting some respite from the situation.
I think that's a key thing that we need to talk about, and that's the family too.
Yes.
It's not just the client. How often do we talk in the senior community about people who need care, or whatever type of care, or a product, or need to go somewhere? Well, it affects the whole family. It affects the spouse, the children, and sometimes the senior may not even recognize that at first.
Exactly.
They think, well, that's what my husband's here for, or that's what my wife is here for, is to care for me.
Right.
Well, wait a minute, if she's losing weight or is stressed out by it, it affects her, which then affects the daughters who are all worried about them.
Exactly.
It extrapolates down, right?
Right. Yeah, it really does. And sometimes what we go in and do with those family meetings is kind of translate, because sometimes the parents or the older adult have been kind of rubbed the wrong way by their kids. They perceive it as nagging. My son or daughter keeps harping on me about this, or keeps telling me about this, and so kind of spinning it a little bit so that they understand the root of the basis of that concern that the family member has, allows them to be able to see that the nagging per se has been genuine. It's been for good reason.
Do you find that as a third party coming into the situation, sometimes a family member is more willing to listen to you as a geriatric care manager than a daughter or a son or a spouse who may have said or alluded to the same thing.
Yes, absolutely.
Yeah,
And if I could
yeah.
figure out what it was and bottle it up, I would do that. But yes, I think I think first of all, older adults, when we come in, I mean, we're describing to them that our role is to listen to what they want, identify what they need, and help everyone around them who loves them and supports them figure out how to help them get there.
Right.
And so I think they feel very relieved that we're not coming in with any sort of an agenda.
Right.
And so that takes some of the stress out of the situation. And I think that they trust us just as they do with authority figures, doctors and such, that are able to kind of look at things differently and sometimes a little clinically to be able to tell them, well, I know that you see this way, but this is actually what we're seeing, and kind of help them maybe see some of the weaknesses in their care situation.
Yeah.
And then I think when they see that we really are about putting a plan in place that supports them, that isn't just, so many people are, for example, afraid of being, taken to a home, thrown into a home and forgotten about. And so then I think when they see that we are going to put forth a good effort to promote their independence, to make sure that the family is listening to what they're saying, that's a very important part of the process. And I think
Yeah.
once they see that, that kind of calms things down. And that's sometimes what an objective person does, is simply come in and neutralize the situation, which has its advantages when you're dealing with a family unit.
Yes, yes, I would agree. So if somebody's looking to hire geriatric, and I use the word geriatric care manager, is that not?
Well, our national association is getting away from that.
Is it?
I think,
Okay.
yes,
That's
I
good to
think
know.
geriatric is just kind of a word that a lot of people don't
Care
identify
manager.
positively
My
with. So the care
apologies.
manager. But yes, so people, if they wanted to find a care manager near them, our national association, the web address is caremanager.org.
Okay.
And you can do a zip code search. So we sometimes will have people who the children live here, but their parent lives out of state. And so sometimes, based on what they call and ask me, I say, well, I'm not familiar with the resources, for example, in Minnesota. So obviously they need to be connected with someone. So we can go on our national website, as the public can, and do a zip code search to try to find some care managers in their parents' area,
Great.
which will be helpful to start the process there.
And then there's a list. If you keyed in Charlotte, it would list out different care managers.
Absolutely.
That then could help.
Absolutely. Yes. Yeah. And the first sign that you're working with a good care manager is obviously somebody that belongs to that national association. It's
Right.
the only association that really encompasses all of the care managers across the country. And you want to look for someone who's been in business for several years, who can give you professional and family references. I think that's important when you're going to be working with someone, because when you're entering this relationship, most of the time it's not just a one and done meeting. Very often it's lasting months or years. So
Right.
you want to make sure you're matched with the right person. And spend some time researching. You definitely want to make sure that the person is nationally certified. There's 5 different certifications that a person can have to be nationally certified as a care manager. So you want to make sure that they have one of those certifications. And most certified care managers have a master's degree. A lot of our backgrounds are gerontology, social work, nursing. So obviously we're going to do things a little differently based on what our background is.
Right.
So that's something that might be worth looking into, is seeing if you can find kind of an assortment of people's backgrounds to kind of compare if you're going to try to figure out who you want to work with in any
And
given
can you
market.
ask for references from?
Absolutely.
Yeah, okay.
Absolutely. I'm always happy to offer it, and very happy when families say to us at the end of our service that they would be willing to give recommendations. So we definitely have folks we can connect you with if you're interested. Yeah.
Good. And to touch on something you just said, this is not always a one meeting thing. This is ongoing. You're going to
Right.
talk with somebody and deal with them perhaps for more than a year.
Right.
Or
right.
more than a couple years.
Right, right. I would say we are definitely willing to meet with someone. Most of the time, the people that we meet with just once are people that are kind of getting their ducks in a row to bring mom and dad to the area.
Right.
So they want to meet with someone, figure out if we can introduce them to a care manager wherever their parent is, and kind of get that process started. And then that person may come back to us whenever their parent comes into the area, and then we kind of begin the care management process. But yeah, most people have some caregiving challenge, and that can't be solved in one meeting.
Right.
And so to go through the traditional care management process is going to take a little bit of time, and obviously things change. That's about the only constant in aging. So we want to be able to be available to the family on an as-needed basis. so that as their loved one is hospitalized or as they start to see some indications of decline, that we can kind of get involved sooner rather than later. We always care management is preventative, so we always want to try to prevent the non-essential trips to the emergency room and that sort of thing as much as we can by making sure that they've got a good, strong care environment at home.
So you're kind of like a general contractor in that you then turn to other people within the community when needed and when you see the need within the family.
Right, yes. There's a care manager that describes herself as kind of a wedding planner for aging. Right. so yes, a general contractor, that's a great, we're conducting the symphony. We're getting everything kind of organized and going in the right direction, making sure that everybody's on the same page, and that's a lot of coordination, kind of project management skills. You definitely want a care manager who's going to be organized, who can really approach this with strong problem-solving skills.
Yes.
But yes. Yeah.
And a good listener, probably, right?
Yes, very good listener.
All right. So how long is a care manager usually involved with the family situation? We touched base on that, but is there an average length of time, or does it really depend on the family and the situation?
It really depends on the family and the situation. Every care manager would probably have a different answer for that in terms of how long what the average is. I would say for our firm, it's about 9 months, somewhere in the 9 to 12 month ballpark for average clients. But that is going to vary. And of course, like with anything else, we go through periods of time where we have some short-term clients, because some people don't find us until they're in a crisis or until the person is already in a care facility. And so we can still do things for that person. We do a lot of advocacy for clients. We do a lot of covering for the family while they're out of town, in an emergency capacity on an on-call basis. So there are things we can do for people no matter where they are within the long-term care spectrum. But obviously there's more that we can do to keep that person independent the sooner they come to us. But we do have some people that, unfortunately, with their health or the circumstances, we are only able to work with them a few months before they pass away.
I'll tell you, I've been in this industry, as you know, for many years, and we all get these calls from family members that get into dire situations.
Yes.
All of a sudden, somebody's hospitalized or somebody's coming out of the hospital. I mean, I hear about it every week where somebody goes to visit a loved one in a hospital to visit, only to realize the same day they're being discharged.
Right.
And because the world has changed.
Yes.
Frankly.
Yes.
And it's nice to have a care management group, care managers that can be that focal point for the family to help facilitate the needs of what that individual needs.
Right, right. It's key, and I think the hospital is a good mention, because I think that environment really just kind of breeds a bit of the chaos that families are experiencing. And when they go, and you're right, they show up for a visit only to be encountered by the nurse or the social worker who happens to mention that they're going to be going home in 5 hours, and you suddenly realize that you're being given a list of facilities and you don't know one from the other and what you should be asking or what you should do next, and it just kind of gets dropped on your lap. And part of that's just the nature of healthcare. You're not in the hospital for as long, and sometimes they're working within Medicare's very strict requirements about whether or not they can keep someone for additional time. But that process it can be very taxing on a family, and so very often we'll have families that reach out to us in those situations where it's an urgent call. They need our help within the next few hours, not within the next few days. And so as we are able, we work with those families and help them with that. And there's obviously somebody in the hospital that's initiating that discharge process. The discharge planner is coordinating key pieces of that. What a lot of people don't realize is that once the person leaves the hospital, that discharge planner can't do anything to help you any longer. And so sometimes we're the person that kind of bridges the gap. We get started working with the person while they're in the hospital, and then we can continue to follow them after they're outside the hospital, which is one benefit of having a care manager.
Yes, continuous assistance is key.
Right.
Because there are people, like you say, at the hospital, a discharge planner, even if they get discharged and go to a rehab, okay, there's a social worker there, but it doesn't flow through admission, discharge again, possibly.
Right.
Home health care, well, who's going to select the DME equipment? And
right.
I think, and what's going to happen when a skilled nursing agency's time through Medicare winds down, then what happens?
Exactly,
Yeah,
exactly. And families really, I think most people have a need, even if you're not very organized or you're not a planner yourself, most people feel the need when they don't have control over something. They feel the need to have a plan and know what's happening next. And
Right.
when you have, as you described, the kind of the connectedness, but yet the disjointedness of the handoff that happens,
Yeah.
a case being handed off from the hospital to rehab, to the home health, to back at home, or possibly assisted living, that's 4 or 5 different people in relatively the same capacity involved, but none of them are focused on the big picture.
Right.
All of them are focused on their part, and rightfully so, that's their job. But I think families at some point, after they've done that enough times, they see the value in having somebody that can step back and say, okay, I can start working with you and I can be involved for the duration, no matter where this person goes, and we can help make sure that everything's focused on the big picture, which is key. Sometimes I've had to go into the hospital and tell the discharge planner, this person's home environment is not safe, and the discharge plan was to send them back home. And without that information, maybe it was something that the family wasn't going to share, but without that information, the discharge planner would have sent the person home. So I really see it as we need to be helping everybody else who is trying to help this person see what the big picture is, what some of the potential areas of risk are, to make sure that there's not anybody that's suggesting or recommending something that's to the detriment of the client.
Right, and also you have options to give them.
Absolutely.
Whereas a lot of times, not a lot of times, on occasions, if you're being discharged from a hospital, the discharge planner's trying to get you, work so that you get the needs covered, but maybe not all. They might say, well, work with this particular skilled nursing agency, and what would you know the difference of?
Right.
Whereas a care manager would say, well, there's, for example, in Charlotte area, 4 or 5
Right.
skilled nursing agencies
Right.
and you would know that some of the people in all 4 or 5 of the groups that handle that.
Right, exactly.
Makes a big difference.
It does, it does. And
With the ratings of an assisted living.
exactly.
If you're not in the industry, you wouldn't know that assisted livings and skilled nursing facilities have ratings, which you can check on as a family member or through a care manager.
Right.
And they can do that on behalf of the family.
Right, and the other advantage is we have a lot of clients who are in care facilities, and so we're in and out and familiar with a lot of the care facilities in that capacity as well. But yeah, I think that's an excellent point. I think the other issue is that Mecklenburg County, all of the facilities are not kind of equally distributed, and so there's some areas of the county where there really aren't a lot of facilities to choose from.
Right.
I've likewise been working with some people where they pick a care facility on the opposite side of the county because that's where they work, and so maybe it would make it easier to go see mom or dad if they were in a facility closer to work. And so I think, sometimes the assumption is we need to get this person out or to the place that has an opening or to the place nearest the daughter's zip code or the person's zip code from where they were coming from, and that's not always going to be the best for the family in some cases.
Or a new building. For example, in Charlotte alone, there's 4 new retirement communities in the last year.
Right.
And that probably wouldn't all show up immediately on Google if you did a search yourself.
Exactly.
But a care manager who lives in the area would be able to tell them about new communities.
Exactly.
Yeah.
And you're right. Baby boomers are going to, to the internet to do a lot of their preliminary research. And unfortunately, I think a lot of senior service providers, or at least it's been my impression, haven't necessarily been at the forefront of having good internet presence. And so sometimes when you are looking for a nursing home, you might find the corporate web page, but no information about the local building, no pictures, that kind of stuff. And that's really kind of what the family is looking for when they're looking for information, is for that specific building. So yeah, we definitely are able to kind of help them out, with that part of the planning. And again, like you said, the important piece is making sure that whatever the discharge planner is putting into place is actually implemented. That's a big risk on their end. They're putting together a plan and they don't know what's going to happen to it when it walks out the door with that patient as they're being discharged. And so particularly if someone's going from hospital back home, we need to be in the home to make sure, okay, are these service providers, have they actually been hired? Are they showing up? Is this enough coverage? Do we need to add to it? What are the changes that we need to make? Because some of that you don't really know until the person comes back home.
And a lot of these things change on an ongoing basis. For example, Medicare, you probably are quite familiar with how Medicare and Medicaid works and what it pays for and what it doesn't pay for now.
Right, and that's something that changes.
Constantly.
Medicaid, yeah, definitely on an annually basis. So yeah, that's something that surprises some people, is that Medicare is not picking up the bill for more of it. And so explaining those benefits and how they work, and getting families to recognize the financial constraints of the situation is sometimes key to being able to put a good plan in place. I could put a plan in place that's going to cost someone, $50,000 a month, but that's not going to be any good if they're living off of $800 from Social Security. So we need to be able to put a plan in place that's going to work for the family.
What do you see any current trends in the industry that's different from, say, 5-10 years ago?
I would say there's a lot of evidence that service providers are definitely having to think outside the box in terms of meeting their clients' needs. And I think the financial constraints, certainly during the recession, a lot of people's retirement accounts dwindled, and people found themselves living on a lot less money than they were before. And so people are having to be creative about how to make care work. There's a lowering, a diminishing income cap for Medicaid, and there's an increasing cost of care. So you've got a lot more people that are in that middle zone where they can't access Medicaid services, but they don't have enough to pay for something privately.
Right.
And those are a lot of the people that come to us. The people that
Caught in between.
we need to put something that's kind of a hybrid between private pay service providers and using family support or other informal sources of support. So there's definitely some good kind of new ideas out there, which is exciting to see.
What are if someone was looking to hire a care manager without going into specifics, and they want to hire a care manager, does insurance pay for this, or is it private pay? How does that work?
It's predominantly private pay.
Okay.
Long-term care insurance policies sometimes do cover our services. Really? So yes, so when people call us, that's one of the first questions I ask, is whether or not one of the clients would have a long-term care insurance policy. We're always happy to take a look at the policy and see up front, whether or not there'd be coverage. But luckily, there's an increasing number of people coming to us with those policies, so that's a good thing,
Right.
For them down the road too. But yes, it is a private pay service. And care managers in this market charge by the hour. When you're working with other care managers in other markets, it may be slightly different. There's some markets that charge by the package price and that sort of thing, but here in Charlotte, it's by the hour.
By the hour. And you're seeing a trend of long-term care insurance increasing, you think?
Yes,
Yeah.
yes. Temporarily, I think that will wane again, unfortunately, but there seems to be an uptick in the number of people that have policies, which is good.
Great. Well, Jennifer Szakaly, president and founder of Caregiving Corner, has been our guest tonight. I really appreciate you joining us. I want to thank everybody who's viewed in tonight of Aging with Attitude. Thank you very much, and we'll see you next week.